Welcome, everybody, and good afternoon. My name is Irene Day. I'm the Director of Operations at the BC Centre for Excellence in HIV and AIDS. I will MC this event, and thank you for joining us here today to formalize Brazil's 2013 adoption of treatment as prevention and the relationship between Brazil and the BC Centre for Excellence in HIV and AIDS. Joining me are Dr. Fabio Mesquita, Director, the Department of STDs, AIDS, and Viral Hepatitis for the Brazil Ministry of Health, and Dr. Julio Montaner, the Director of the BC Centre for Excellence in HIV and AIDS. I want to thank you, a big thank you, to the IAS Media Center and the Vancouver Convention Center for their assistance in setting up this press conference. And before we begin, I want to take a moment to say that we at the BC Centre for Excellence are very pleased to have the support of our Premier, Christy Clark, our BC Minister of Health, Dr. Terry Lake, and all the BC government. In just a few minutes, I'll ask Dr. Mesquita to say a few words, and then Dr. Montaner. When both have completed speaking, they will sign the letter of intent. You are free to take photos. Once the signing is complete, I'll open the floor for questions. And there will also be an opportunity for individual interviews, should you want that. Thank you. Dr. Mesquita.
Thank you very much, Irene, and good afternoon, everybody. It's a great pleasure to be here today. We are working together with Vancouver for some time now. It's a very inspirational work that have been conducted here in the city, but moreover related to the treatment as prevention. Of course, Vancouver has a whole history on the HIV response, including the conference 19 years ago that announced the heart therapy for the whole world. That was a turning point of the response, of the global response to HIV. But specifically this year, I think we have another opportunity to be all together here, people from all over the world, to talk a little bit more about the experience on treatment as prevention. So we see that as an important piece of the package of combination prevention. We now know after a while that the strategy of being completely condom-centric is not enough to respond to the HIV epidemic. Despite all the investments of many governments, including the government of Brazil, on condoms and other strategies to prevent HIV, I think a very important knowledge that we learned from science recently was the understanding that antiretroviral therapy can prevent the spread of HIV. Of course, we learned that from the first time in 1994, and by the time we understood that for mother-to-child transmission, antiretroviral therapy would work to prevent the spread of HIV to the baby. But took us few years to understand that the same concept would be also functional for a person who was out of the body of anyone. So you don't need only to protect the baby, but it's useful to protect the person in sexual relations or even for the use of drugs or any other risk for HIV. And I think the pioneers to really highlight to the world and to really announce that to all over was basically the group led by Dr. Julio Montaner here in Vancouver. Took for the science even to recognize Vancouver in this leadership a few years. And now, we all recognize that this initiative that was taken here was very inspirational. So Brazil has adopted treatment as prevention in the end of 2013. And so basically, I came to that position in July of 2013 to be the director of the Brazilian response to HIV, STIs, and viral hepatitis. And a little bit before I came to place, I was working for WHO, and I met Julio in a conference, exactly the same conference that we are having today in Malaysia. 2 years ago, 1 week before I came back to Brazil to get this position, and I said, Julio, we're gonna implement treatment as prevention in Brazil, and I really need your support. And since then, we got a very strong support from Julio for that initiative. He followed up with many support, and basically today what we are celebrating is a more formal way of collaboration, because we have been collaboration for at least 2 years now. We are working together in some of the evaluation of the 2 projects, and we want to publish things together. We want to exchange, send some people from here to Brazil and receive, also send some people from Brazil to here, and get this exchange, because we know that we can learn a lot with the work Dr. Julio and his team is doing here. But we also understand that there are things in Brazil that are interesting, and we can also exchange some of the information. So I believe that's it, and we are very happy to be here today, and I think this is a very important step on our response that's been very successful over years, but we always have ways to improve it, and I think this is a very important step in the response to HIV/AIDS in Brazil. So thank you.
Thank you, Fabio. Julio?
My name is Julio Montaner. I'm the director of the BC Center for Excellence, and happen to be the co-chair for the conference here. I want to thank Fabio for his tremendous support. Back a number of years ago, the notion of treatment of prevention was regarded as very controversial. And to have Fabio come in his position as the lead of the Brazilian program, the largest antiretroviral therapy program of the Americas, with a clear intent, vision, and desire to embrace treatment prevention, was probably the highest form of compliment and support that our program could receive. Things have actually worked fantastic for us. We had dinner about a year ago with Fabio, Michel Sidibe, and your minister. That was a historical event, I think, because we iron out there, right there, the commitment of your government to not only support treatment of prevention, but rather help us get the BRICS countries, Brazil, Russia, India, China, and South Africa, formally endorsing treatment of prevention, which actually happened last December, if I remember correctly. Yeah. During the BRICS meeting in Brazil. As you can imagine, to have the BRICS endorsed formally treatment of prevention, it was a pivotal moment in our campaign to try to establish the 90-90-90 and treatment of prevention globally, because at the end of the day, those countries represent the largest body of HIV in the world. And so even if nobody else signs up, having the BRICS is basically one important 90 almost that is already been met. And so strategically, for us to be able to work closely with our colleagues in Brazil is very, very important. It is not only important because it's politically important, it's strategically important, but as we were saying earlier on, we work very hard most of the time, and it's good to enjoy doing what you're doing. And so being able to work with friends is also very important. And so I really treasure the opportunity to work closely with my, we call it hermanos Latinoamericanos, right? And to promote a closer ties with Brazil. We are uniquely positioned to do that because my senior statistician and close collaborator, Viviane Dias-Lima, she's originally from Brazil, and of course she has a very special affinity for her home country. And so the moment that we decided to start this collaboration, I thought this is going to work wonderfully. It's the first time Viviani doesn't complain about a new assignment. And so we are really already making progress. Viviani has spent time with Fabio's people, and Fabio is sending his people to visit with us. And what we're trying to do is align our thinking so that we can hopefully learn from each other as we move forward. For us, not so much in the context of the downtown east side or Vancouver proper, but for us, as we move to expand our treatment and prevention effort, think of First Nations or rural BC, learning from the lessons from Brazil is very important. And at the end of the day, they're doing things differently than we are, just because they have different realities, different priorities, etc. Fabio today gave an excellent presentation outlining their plans to expand PrEP. It's something that we have not been focused on, we have not been working on, and so we're really looking forward to work closely with Fabio to learn from his experience as he's trying to explore what is the optimal means to implement a PrEP strategy as part of a combination prevention package. So for us today is a very important day. We're very grateful for Fabio's and Brazilian friendship. We promise we're not going to talk about soccer. Or the Pope. Or the Pope.
Or the Pope, yeah, right.
But we're really looking forward to working together. Thank you, Erin.
Thank you. So if we just take a minute to sign the letter of intent, and you can take some photos, and then we'll have some questions.
Do I sign or don't I sign? Until death does us apart.
We still have 3 minutes to think about.
I think this is wonderful. It's a great opportunity. Do you know, Julio, I have a question for you before we open it up to the floor, and I couldn't help but reflect a bit on 2006, when you introduced the whole concept of treatment as prevention at the IAS Conference in Toronto. How do you think things have changed or improved, or what do you find missing today in comparison to that event?
Well, 2006 was a very special conference in Toronto because we truly had come up with a new approach to how to apply treatment to control the epidemic, something that at the time was felt to be highly controversial. And when I say highly controversial, I'm understating. I could say people felt that it was sacrilegious to talk about medicalizing prevention. I got into very nasty arguments. People felt that it was irresponsible on our part to do what we're doing, even to speak that kind of language. There were those that felt that our therapeutic optimism, if you want to call it that way, was going to actually give rise to behavioral disinhibition, and as a result of that, the epidemic was going to be much worse, and we would be actually regarded in the long term as the people responsible for having made this epidemic worse. So, it was a difficult time. I was very fortunate that two people rallied behind us at that conference. One was Stephen Lewis. For the non-Canadians in the audience, Stephen Lewis is a very prominent Canadian that has been the UN Special Ambassador for AIDS in Africa for a large number of years. So he has a deep understanding of what AIDS is all about, and he has followed our work for many, many years. So the moment that I left the podium, he came to me he offered his support. He leaned over and he said, Julio, reach out to me. I'll be there to help you. And be careful because they're going to go after you. I thought it was an intellectual kind of. I didn't know the extent to which he was right. And immediately after, Alison Lawton, who is a very prominent Canadian from Vancouver, who I never met before, grabbed me. He said, Dr. Montaner, nice to meet you. I'm fascinated by what you just explained. I want you to meet somebody. And she took me to a small room. There was security and everything. And lo and behold, President Clinton was there. So I didn't do too badly that day. The president was incredibly supportive. But the fact that these kind of people, the non-science people, were really reaching out to offer their support, while very few others really were prepared to rally behind us, and the criticisms were so strong, sent me a signal that this was going to be a difficult battle. And it was, but very quickly, people like Jupp Lange, in particular, rallied behind the notion, and a number of other friends came to support us. The next pivotal moment was when Michel Sidibe took over the executive director position at UNH. The previous leadership at UNH was not happy with this approach. The day Michel arrived, he agreed to pay a visit to Vancouver during the Winter Olympics in 2010. Nora Volkov, the head of the National Institute of Drug Abuse, had already recognized this as a very important area of research, and she offered to help us. And so all of a sudden, things were starting to fall into place. And Michel, from Vancouver in 2010, he actually wrote a letter to the partners asking for treatment for all in need as a means to stopping the epidemic, which, for Michel, who is not a scientist, it was a very bold statement, and he put himself really at risk. So, in essence, we have come a long way. We went on to develop the 90-90-90, which Fabio has been involved with those discussions as well. And again, it was regarded as controversial, but now the world is rallying behind it. If you walk this conference, whatever, people have reorganized the guidelines, namely the WHO, people have reorganized the clinical trials. Everything is now being looked through the lens of the 90-90-90. So we're on track. We just have to do it now. But I think that, having had HEART in 1996, then treatment prevention in Toronto in 2006, and now the Vancouver conference in 2015, really being the coming out of treatment and prevention as the global strategy to end the pandemic, to me is extremely gratifying. And the more that we can work together collaboratively with international partners, important international partners, such as Brazil in this case, to demonstrate how these things can be done, to illustrate how they can be implemented differently in different places, because at the end of the day, that's the way it has to be. It's really a fantastic opportunity. We will need a lot of support. I'm grateful for the political support that we're getting from Brazil, because that sends a very powerful signal to the rest of the world, including my own prime minister, who is not yet able or willing to say the word AIDS or treatment and prevention or 90-90-90. Fortunately, there is an election coming up, and I hope that that's going to sort out this problem. But I think that while there are challenges, today I sense the kind of optimism that we had in 1996. In 1996, we solved the problem at the individual level. In 2015, finally, we have solid scientific consensus and normative consensus that this is the way to stop the pandemic. And we are at the center of it, and that is actually very gratifying.
Great, thank you, Julio. Fabio, Brazil has made some tremendous gains in terms of their curbing HIV. What do you see as the challenges going forward for your country?
I think, thanks for the question, Irene. I think, so we have 30 years of the Brazilian response to HIV has a very well reputation, and it's a good response. But a few years ago, I think somehow we accommodate and was basically living from we accommodate and was basically living from the success of the past experience. And so there was not too much innovation, and we were very focused on the classical prevention strategies, and too much centered in condom. And I always joke because, so as medical doctor, sometimes people say, so you are prescribing drugs for people now to prevent HIV. And normally I say, I think there is no worse prescription or direction from the doctor to say you should use condoms in all sexual relations, and you can't do anything without using condoms, and you cannot think outside of condoms. And like, it's really a prescription because you have zero other options when you do that. So I think it's far more medicalized in that sense than when you have some options. Today, in the last 2 years, we worked very hard promoting male and female condoms. We keep promoting harm reduction strategies. We are improving areas that were left out a little bit, like testing. We are having a lot of alternatives in testing. Tomorrow morning, there is a publication in the official newspaper of the Brazilian government on a new guidelines that we did for PEP. We do have a PEP strategy that was somehow broken in 3 different PEP strategies, one for health professionals, one for sexual violence, and another one for accidents. And we joined in one PEP strategy, and this will be published tomorrow morning as another important use of antiretrovirals for what we call the next day pill that they say for pregnancy. We call the next 28 days pill for HIV, which is PEP. But we also are working very hard in treatment as prevention. And I think it's been one of the most successful interventions we did in the last year after all these connections. If you consider the number of people in treatment in Brazil in 2014, we got almost a double of people in treatment than in 2013. And if you consider the people who is getting treatment with CD4 over 500, is more than 40%. Meaning, so we are really getting people early, and we are really pushing for treatment as prevention as a key strategy. And as you heard this morning, we are considering very seriously the PrEP strategy, because we believe that if we have these alternatives of combination prevention, that would be more useful. So the biggest challenge for us is how to reach key populations. And as you know, Brazil has a similar epidemic of Vancouver in that sense. We do have a concentrated epidemic, and we really need to be very open and work together with people who use drugs and transgender, sex workers, and gay people, because this is where our epidemic is. And we have a very interesting strategy that we developed in the last year for youth. Again, is another challenge for us, because this new generation from our studies far more liberal than the previous generation of HIV. They have far more sexual partners, and they use less condoms than before, and they are less concerned about HIV than before. So there is a big investments in this strategy to get close to the youth people and get their way of communications, to use Facebook and Twitter and some of the apps that they use for encounters like Tinder or Horner, because those are the ways that we can get to the youth people and try to face this fact. But a key strategy for us in all this combination prevention is really to get through the alternatives for people, and treatment as prevention is a very key element of it.
Thank you, Fabio. There's mics at the back if anybody wants to ask a question. And Julio, I'm going to ask you another question, and that is, there have been other presentations at this conference from other provinces in Canada who haven't been quite as successful as British Columbia, and I'm wondering if you wanted to comment on that.
Well, you know, as everybody knows, we have a serious challenge nationally because we don't have an effective national strategy to fight HIV and AIDS. And so while British Columbia has done quite well in bringing down the worst epidemic in the country to below average today, unfortunately, there are epidemics in Saskatchewan and Manitoba and in various other cities, including Ottawa, that are more than compensating for the success of our approach. And so Brazil, on the other hand, has a federal strategy that allows Fabio, in his position as the head of the program, to bring a common set of standards for the whole of the country. And while I have no doubts that they have regional challenges, and we discussed that before, at least the starting point is that we are all doing the same thing, or at least reading from the same partiture. In Canada at the present time, the access to services is very different in various regions in the country. And at the end of the day, people who have challenges, either because of social, demographic, or economic, or comorbidities, or any other challenges, are being left behind. And nobody in this country is currently most overrepresented in the context of the epidemic than our First Nations communities. And that's true in British Columbia, and it is true across the country. And this, unfortunately, is something that we will not be able to address as a single province. We need to address federally. The federal government has a responsibility to provide for or support for the First Nations communities, and we have called them repeatedly for not stepping to the plate to address this, which is a federal responsibility.
Thank you, Julio. If there's no questions, then we'll conclude the signing of the letter of intent. And I want to thank both of our very, very distinguished guests here. So Fabio and Julio, thank you so much.
Thank you.
Okay.
Thank you.
So we'll do some photos, Fernando, if you wouldn't mind, with the signing.